Well, as usual, what we like to do is just kind of not even recap, but bring you up to date because so many things change, so much new information, new data, and how you interpret new data changes by the hour. So, as we were talking last week, a lot of the discussion surrounded testing and kind of reintroducing our way of life, even as slow as it may be, back into society. What has changed, either hopefully positive, but maybe even negative, depending on any type of data or what you and others have realized in the past week?
So since our last conversation, I think that there is a clear improvement in terms of the number of people getting admitted, the number of people getting discharged, and maybe even flattening of the mortality rate at this point. So I think that things will point to the fact that slowly we're moving in the right direction, or this episode of this pandemic is waning. Um, we've had a spike in some centers in the country this past week, which may have again thrown a little bit of a dark information, if you will, in terms of is this really going away or not. Many of us who deal with this issue suspect that this was either a real spike in terms of maybe recurrence, or most likely this is due to Easter/Passover. So we think that we're still seeing the numbers as this spike sort of wanes go down. We are getting more testing, even though we're seriously behind in the ability to test. What we're getting also is a better understanding of the diagnostic test in terms of both the prevalence of the disease right now in different areas. But as long as we're hampered by the ability to test as we go along, anyone that we feel should be tested, we're still going to be missing some information in terms of the prevalence as well as recurrence. Hopefully that as the economy opens, and you're seeing quite a few states now relaxing some of their regulations on the distancing, if there is another increase in the number of infections, that I think behooves us to know ahead of time whether that's happening and how it's happening, and that the only way to do that is going to be through testing. Antibody testing is the non-diagnostics. The antibody testing is a whole other conundrum, which I think is essential maybe for people who are running businesses and healthcare facilities, but we're still far from getting that down pat because we don't understand completely the behavior of the virus particles, and also the longevity of the antibodies that are generated by the infection. So that's in a cap, if you will, what we have since last week. I do think that the issue is moving from the seriousness of the pandemic to the seriousness of the aftermath and the post-pandemic in terms of the economy, in terms of social impact. And we haven't really gone through this in full to assess the damage that has occurred and potentially can occur. Many of us who deal with critically ill patients who work in the intensive care unit have asked ourselves, what happened to all the patients that normally come to the intensive care unit? And our thought is that they're out there, hopefully surviving, but many may have not. And the question, of course, is this something that we're going to see in terms of now increased burden on hospitals as well as in the population, because healthcare issues have been either delayed or not taken care of at all. And as you know, we have diseases out there such as diabetes, heart disease, and cancer, which if they're not addressed, certainly can cause some significant health problems for people.
So is that kind of like a second surge in the hospital that we have to be aware of, or is that something that has always been lingering that hasn't just gotten enough attention?
No, I think that it hasn't been the same in other situations. Um, we're basically, as I said, we haven't really seen a lot of these patients, so we think that they're out there, and make, you know, I hate to call it a surge, but it will be a significant number of people once they feel comfortable coming to the hospital, because I'm sure that there are people who are concerned that if I come to the hospital and I have, say, heart disease and I have diabetes, that I may end up contracting the
Right.
virus. And as we all know, if you're advanced in age or if you have comorbidities or both, the likelihood is that you're not going to do well.
But is there
So
going to be, real quick, is there going to be enough of that intermediate area where you still have COVID-19 patients that are coming out, but it's still present, yet you also have people, as you mentioned, who haven't been in the ICU starting to feel more comfortable coming in? So you haven't completely taken out the COVID-19 and you haven't reinserted those people with the regular patients at ICU. Is that where there's that middle ground of surge to where there may not be enough beds, may not be enough personnel?
no, I think there will be enough. I think the big issue is going to be separating the COVID patients from the non-COVID patients in an effective way, and at the same time to continue to protect healthcare providers. I mean, if you're working with a COVID patient and you're called to see a patient who's not COVID, you have to be very careful in terms of how you manage yourself. So I don't think it's a surge per se, but it will be a burden on healthcare at this point.
Okay.
Some of the recommendations or the opening or recovery plan, whether it's the White House or whether it's others, suggest that you should have about 2 weeks of consistent drop in your admissions of COVID patients to open up elective surgery, to open up other healthcare you know facility in terms of caring for other patients.
Okay.
So the issue that sort of raised itself, and that's what we had been talking before, which has been published in the news, has to do with the issue of lockdown versus no lockdown. So far, I could tell you that even places where there has not been complete lockdown, there has been some lockdown, maybe voluntary. So the big one, and I think I mentioned in a previous that it was in Scandinavia, whether I
Yeah.
mentioned it was Norway or so. So we know that Sweden has not implemented a lockdown, and they're doing just fine. We also know now that there have been articles and opinion pieces by scientists, if you will, whether it be epidemiologists or healthcare workers, that have come out of California. There's been one article that I think we shared from California. There's also the same has come out of Israel, where there has been lockdown, essentially challenging the notion that the lockdown is the reason for, again, the recovery that we've seen from this pandemic. These are certainly opinions. They're usually backed by mathematical or statistical analyses. And if you have a laboratory, if you will, which is, we'd say, would be Sweden or possibly even Greece, although Greece has had more of a lockdown, they have a very low incidence of infection and mortality. And comparing it to places like Ireland, where there's very low mortality also, but again, there was lockdown. So, whether we should have had a lockdown or we shouldn't have had a lockdown, I think it's too late to even go there.
Right.
We've had a lockdown, and now it's the question of how quickly we open the economy. And I would say that because there is a little bit of controversy out there in terms of what we should do, some I think in government leadership will decide that they're going to move much quicker than others. And from my point of view, and again, that's my opinion, I can't really fault them for that unless we see a disaster occurring, which we'll do very quickly if that happens. I think the issue of governments and lockdown, and whether the lockdown is the right thing to do, whether the lockdown was the wrong thing to do, we can't dwell on it because we've been locked down, as already mentioned. But there is the decree by the government, and then there is also the individual choice. So I think that if tomorrow everybody said, no more lockdown, do whatever you want to do, I think people are still going to be pretty cautious about what they do. Some people who have not been cautious now will continue to be not cautious, but I think majority of the population is still concerned enough to take small steps. I think that so that if the governors of the states decide that as of, say, May 1st, no more lockdown, you're still going to see a slow recovery in terms of social distancing, mask wearing, etc. You're not going to see a sort of a rush. Although we have seen where beaches have been open, where there is a rush. I think the time will tell us whether there is a concern that there would be another wave of infections due to that, or maybe not.
Well, yeah, we already saw Georgia with the governor reopen up. The NBA said on Friday, this Friday,
Right.
that you're allowed, if you are a team that's in a state that has lifted the stay-at-home order, then you're allowed to participate only in individual stuff, individual workouts, but you can use the gym, you can use the training facility. And the Atlanta Hawks came out right away and said, we're not doing it. The state can reopen, businesses can reopen, but we aren't. So you already see on the front lines of areas that are reopening, places as big of as an NBA team resisting.
Correct. And you know, when you read about the what's happening in Sweden, nursing homes there voluntarily shut themselves down. I mean, so I think the human element of the shutdown is going to linger longer than the permission to go back to and reopen. But I think that we're you know, the big concern once we reopen is the return of this economy, which is not going to, you know, it's predicted not to be as quick as some in the government say it would be.
Well, are we under a time constraint, or are we battling a clock in that our economy has to reopen in a finite period of time before a second wave of this virus hits?
I think that if the economy stays stagnant the way it is right now, that the second wave, which may be again as predicted in the fall, right, will be clearly not that would be not the big issue. It's going to be
The economy.
it's going to be more the economy.
As far, real quick, as far as
Yeah,
the
sure.
second wave and really as far as reopening, there were a couple of studies that came out, New York, California, Florida, where it basically said, in a nutshell, the rate of infection significantly higher than initially thought, which actually would be a good thing in this case, because that means there are significantly amount of more people out there who are asymptomatic. It brings down the death rate as well, and actually minimizes, and I hate to use that term, but it minimizes not from emotion, but from an area. It minimizes where the outbreaks are, which are predominantly nursing homes, areas like that. I wonder if data like this and real life could meet, and at some point we do approach it like Sweden and say, look, even if a second wave comes back, so many people have had this, they were asymptomatic, they have antibodies. A second wave and going back to the economy won't be as bad if, in fact, these studies are true.
So again, these are models, and models change on a dime, as you know, because as we feed more information to these models, they become, I wouldn't even call it more accurate, but I guess more reflective of what's going on.
Okay.
So I think the true incidence right now is suggested to be higher than what we have as far as information. And that's again based upon modeling. I think the CDC has put out some information, I think early today, about the fact that it's probably much more prevalent than we think, which again, as to your point, is reduces the rate of mortality. Um, you could see also on a state by state that even though predictions, I'm just going to use one state as a model, it would be Florida, where the modeling showed that we would have a significant number of deaths associated with COVID-19. In fact, that did not happen. Now, you could say it's because the governor took the effort to do the lockdown. Whatever the reasons behind it is that the mortality numbers are low. And we're starting to recognize also as we do more testing that more, as to your point, as to more people may have had the virus but did not exhibit a significant enough illness to be hospitalized. So all these issues are going to be probably better focused on once we have an opportunity to do what's called a look back to see how many people really carried had the virus versus the total number of deaths that we had. I think that what people forget is that sometimes every year or every other year, we prepare in the winter for the flu season.
Right.
I'm talking about from a hospital point of view. We create plans for being overrun by a number of people who have the flu who require hospitalizations, generally people who have some other illness that become sick with the virus. And most of the time it's respiratory. And ERs are flooded during that time. Beds are at a shortage, intensive care units. So we've had this before without any lockdown. I think that for some reason we have the impression that this one is worse, and it may be that the rate of infection is much higher with this particular virus than we've seen with the influenza virus. But we've been overrun before by, again, a epidemic, if you will, such as the influenza, but not worldwide pandemic. So going back to your point in terms of the second phase, I can't, my opinion is I don't think it will be as bad as the initial one.
Okay, great. Anything we should end on or just chat next week?
We could chat next week. Hopefully we'll see a big change in terms of how the economy is coming along, because a lot of people have plans, including you.
Yeah, I know. And we'll actually have at least a week, if not more, to look back and see if there are any spikes in areas that have reopened as well. So hopefully there aren't.
Correct.